The question of today is, can I conceive after ectopic pregnancy? And guys, today I want to talk about ectopic pregnancy, and make sure you watch this video up to the end. Guys, if you're not subscribed, I don't know what you are waiting for. Please consider clicking that subscription button, and also consider consider turning on your notification bell so that every time you get notified when we upload a very important video. So guys, what is ectopic pregnancy? Maybe I will be talking about ectopic pregnancy, and most of you doesn't know the meaning of ectopic pregnancy. So in this video I'm going to talk about what is ectopic pregnancy, how can we manage ectopic pregnancy, what are the signs and symptoms when you have ectopic pregnancy you will experience, and the last thing, can you conceive after ectopic pregnancy? Guys, make sure you watch this video up to the end. I will continue reminding you. So guys, so guys, ectopic pregnancy is any pregnancy that is implanted outside the uterus. After fertilization, you know very well the fertilized ovum or the fertilized embryo should move to the uterus so that it get implanted there, so that that is where the baby will grow, because the baby cannot grow along the fallopian tube. But in some cases you get that after fertilization the baby can get implanted in the ovary, outside the ovary, or maybe in the peritoneum, in the abdomen, or in the cervix, or maybe in the liver, any part inside the abdomen. Ectopic pregnancy can get implanted there. So what can cause this ectopic pregnancy to be implanted outside the uterus? Another thing that I'm going to talk about is signs and symptoms of ectopic pregnancy. How can you know that you have an ectopic pregnancy when you get pregnant? Mostly, this pregnancy sometimes when it is along the uterus, along the fallopian tube, I mean, it cannot grow to it cannot grow to term, of course, and usually the woman will discover this before even 3 months, before even 3 months or 4 months. The most likely time that this pregnancy can be discovered is between 4 weeks to 8 weeks. So what are these signs and symptoms that will set in when you have an ectopic pregnancy? Number one is slight severe abdominal pain with slight bleeding. And severe abdominal pain will come first, and then you will have slight bleeding, because maybe this ectopic pregnancy is ruptured, or maybe it is expanding the the fallopian tube, and you get that it can have some slight bleeding, vaginal bleeding. So the first thing that will set in is severe abdominal pain with slight bleeding. The next thing that will come in is dizziness, and the patient may collapse even without knowing that he is pregnant. And maybe then the patient comes to the hospital. Usually, if you are a woman, most of the time you usually ask about the last menstrual date, and this one will help us to know if you are pregnant, or if you can we can do the other test, urinalysis, or we can send you for ultrasound to confirm if you are really pregnant, so that we get how to manage whatever you are suffering well. And then the next thing that you will experience is nausea and vomiting, and also maybe balloting. These are just minor. The major one are the severe abdominal pain, and the slight vaginal bleeding. Because when you are pregnant, you are not supposed to bleed, and if you bleed, maybe you can think that you are having abortion, but you are having an ectopic pregnancy. So those are some of the signs. What have I said? I've said the the severe abdominal pain, low abdominal pain, and maybe the pain at the flank where the ectopic pregnancy is, and then the slight vaginal bleeding. You can also have shoulder pain. You can also have shoulder pain. You can have dizziness and the patient may collapse, and you can have nausea and vomiting, and then blotting, not balloting, blotting. Those are some of the signs that a patient will experience when you have an ectopic pregnancy. So, guys, can you see this? This is what I want to talk about. These are the ovaries. These are the ovaries. And this is the fallopian tube where the fertilization should take place along there. And then it should travel. It should travel and get implanted into the uterus. And this is the uterus, and the cervix is down here, and the vagina is below the cervix. So in some cases, I've said you get that in that diagram where you can see the fallopian tube. You get that after fertilization, the ovary, the embryo, the zygote refuse to move to the placenta, and it get implanted in the fallopian tube, or maybe it can get implanted outside the uterus, or maybe in the ovary, or after coming into the uterus, or after traveling into the uterus. For it to get implanted there, it can pass through up to the cervix. That is when we will have what is called ectopic pregnancy. I don't know if you're seeing this diagram, right? So, what are the causes of this ectopic pregnancy? So, the first cause that may lead to ectopic pregnancy is PID, pelvic inflammatory diseases such as chlamydia, gonorrhea, and these diseases sometimes after maybe you had one, or maybe you suffered from one and you get treated, they sometimes leave scars inside the womb or adhesions, and these adhesions or scars, they're the one who can cause ectopic pregnancy, whereby after fertilization that zygote cannot move to the uterus so that it get implanted there. Second one is multiple abortions. Guys, instead of doing abortion, better you do family planning, because if you do several abortion, you will get that the womb will get scars and adhesions, and these adhesions are the one which after fertilization they make the zygote or the fertilized ovum not to move to the uterus. So you get that in future when you want to get pregnant, or if you get pregnant, you will get ectopic pregnancy, a pregnancy that can get implanted outside the uterus. The second one is use of postinatal or P2. Those who are used to using postinatal after doing unprotected sex, or after doing sex without plan, they get pregnant and then they use postinatal or P2. In future, when you get pregnant, you might have ectopic pregnancy. And you know, ectopic pregnancy limits you to have a number of children that you may want to have, because you get that when you get an ectopic pregnancy, the most likely procedure that will be done to you is, or for you, is surgery, where they will cut the fallopian tube, and you will remain with one fallopian tube. And if you will remain with one fallopian tube, you will get that number of children that you want, you may not get them because it reduces those chances. So, because the reason why I'm saying that, postinatal usually disorganize the uterus. So you get that your uterus will have so many adhesion and so many scars after you have used postinatal. Postinatal, you should use it only twice in a year and not two times in a 12 months. So you get that if you use this postinatal several times, it can cause disorganizing of the uterus, and this will cause or or will make you to be at risk of getting ectopic pregnancy when you get pregnant in future. The next one is pelvic surgeries, or pelvic surgery, or the surgery in the abdomen. You get that if you have been done for this surgery, maybe in the uterus or maybe in the fallopian tube, maybe when you are doing a BTL, permanent family planning for women, if it fails, if it fails, you get that if you get pregnant when you have a BTL that failed, you can have a ectopic pregnancy, because there will be scars that after there will be scars and adhesion along the fallopian tube. The second one is endometriosis. This is the layer of the uterus, and it is the inflammation of that layer of the uterus, and you get that this sometimes it get implanted outside the uterus, and if that happen, you can have ectopic pregnancy. The second one is smoking. So I see most ladies they smoke shisha, they smoke shishas, tobacco, a lot of chewing, and this can cause a lot of problem in future when you get pregnant or when you want to get pregnant. So smoking is dangerous not only for the lungs, but also in other parts of the body or in other organs. It can cause problem, like you can have ectopic pregnancy when you get pregnant in future. The next one is history of ectopic pregnancy. You get that maybe one of your pregnancy you had a ectopic pregnancy, and you get that you are likely to get another ectopic pregnancy if maybe the cause, or if maybe what was putting you at risk of getting ectopic pregnancy was not dealt with very well. So if that problem is still there, you get that you can still have an ectopic pregnancy in future. And if you get an ectopic pregnancy twice and your ovary, your fallopian tube get cut off, you will not get pregnant. So history of ectopic pregnancy can cause ectopic pregnancy in future. And also the family history of ectopic pregnancy. Maybe if your family are those people who had already suffered ectopic pregnancy, you get that you may get ectopic pregnancy when you get pregnant. So the next thing that I'm going to talk about is management of ectopic pregnancy. Management of ectopic pregnancy depends on where there is that pregnancy, where that pregnancy is. If it is inside the ovary, sometimes they can leave it with caution. If it is maybe in the peritoneum cavity, the doctor can decide to leave that pregnancy under observation. If it is maybe in the gut, the doctor still can decide to leave it there under observation. But if it is in the fallopian tube, it is narrow, and therefore the pregnancy cannot grow there until term. So when it is in the fallopian tube, because that is the most part that usually has ectopic pregnancy, therefore the doctor will decide how to manage it, or the management of this ectopic pregnancy will be discussion between you and your doctor. So it is not a must that you have surgery for when you have an ectopic pregnancy. There's some medication that can be given, and then it dilutes that pregnancy, or it dilutes the formed zygote, and then you can continue living, and you get another pregnant. But in some cases, when it is in the fallopian tube, that is where you will mostly the surgery will be performed. So management, we have the surgery where it depends with where the the pregnancy is, and we have some medication like anti-cancer that you can be given, and then it dilutes the formed zygote. And also the doctor can decide to do a vacuum aspiration, where it aspirates that formed ovum or that formed zygote, and then you just get well. After the procedure, you must be given, or according to how you discuss, or according to your condition, you might get that for the doctor to prevent infection and a lot of pain, the doctor will give you some antibiotics to prevent infection, and also the doctor will give you some painkillers so that pain can be relieved. So the next thing that I'm going to talk about is how can you know that you have ectopic pregnancy. The only accurate way to know that you have an ectopic pregnancy is first by doing urine tests for pregnancy. If the pregnancy turns positive, then the doctor has to confirm with an ultrasound so that he or she may be sure where this pregnancy is, so that they can decide which procedure or how to manage this ectopic pregnancy. So it is just ultrasound and urinalysis for pregnancy test. So the next thing that I'm going to talk about is about can I get pregnant after ectopic pregnancy? And my answer will be yes, you can get pregnant after ectopic pregnancy under this condition. First, it depends where the pregnancy was. Second, it depends how the doctor managed the ectopic pregnancy. If the doctor disrupt, or maybe you had two ectopic pregnancy at the same time, when maybe for example you had twins, then the doctor cut two fallopian tube, then you will not have ectopic pregnancy. But most cases, the ectopic pregnancy usually happen in one fallopian tube. So if it happened in one fallopian tube, you can still get pregnant with the other fallopian tube. So your question is, you can still get is answered like you can still get pregnant after ectopic pregnancy. If you're watching this video for the first time, please make sure you subscribe. And if you're a returning subscriber, I'm really appreciating. And then make sure you like this video, you turn your notification bell, and you share so that we grow as a family. So let's meet in my next video.